Good morning. Today we'll be talking about diabetes and the eyes, using this unique opportunity of both the World Diabetes Day and the World Sight Day to combine the two. Thank you, Dr. Isiavwe and Dr. Mildred, for coming on the program. It's a pleasure to have you both with us.
Good morning, Dr. Pamela. Thank you for having us.
Thank you, Dr. Pamela.
Now, if I can kick off with you, Dr. Isiavwe, as a specialist in this area, endocrinologist and a specialist in diabetes, can you just tell us generally, for those who are listening and who might not know, what is diabetes and how does it affect the body?
Thank you, Dr. Pamela. Diabetes is a chronic medical condition, and when we say chronic, it's something that is like for a few days. And it has some symptoms, what we call polyuria, that's frequent urination, unexplained weight loss, increased thirst. Having said mentioned the classic symptoms, it is important to note that over 50% of persons with diabetes type 2 will be asymptomatic. So the importance of screening comes in. They would likely be picked up at the eye where they go for maybe cataract or reduced vision, or probably they have a wound or have suffered a stroke. So what diabetes generally does to the body is when it's not properly managed, it can lead to complications, and all the systems in the body, no system is spared, from the eyes to the heart, to the kidneys, to the feet. Even for women with poorly managed diabetes, they tend to have fetal wastages. So it's a condition, when not well managed, can lead to serious complications.
Thank you for talking about that. And I know this year we're supposed to be talking about diabetes and well-being, but I think, specifically, we want to single out the eyes. You've spoken about the fact that a lot of people are asymptomatic. Is that the reason why most people in Nigeria are undiagnosed?
That is partly the reason most people are not diagnosed. And again, the health-seeking habits of the individual, where people are struggling to eat, it wouldn't be the norm for them to just go for a routine health check. So many of them would come down if they don't have health-seeking lifestyles.
How common is diabetes in Nigeria?
It's quite common. Up to like 10% prevalence in Lagos. The prevalence varies from rural to urban areas. So it's not a rare condition, it's common, especially the type 2.
Okay, so now we want to talk about the diabetes on the eyes specifically. And perhaps should I bring in Dr. Mildred here?
Yeah.
And say, can you join the conversation? Let's talk specifically about the eyes. How commonly, we've heard that diabetes and diabetics don't know that they're diabetic, but how common do people know, particularly if they are known diabetics, that diabetes affects the eyes? Is it common? Do people know about it?
That knowledge is not very common. We see a lot of diabetics who have no clue, about whether there's anything going on with their eyes or whether they should check their eyes. That knowledge is not really that common. And I guess that's why these programs are important, to educate the populace, that once you've been diagnosed diabetic, you should get your eyes screened, because they could have problems without even having symptoms. They could be symptomless, and yet things are going on with their eyes. And unfortunately, once it blinds the eyes, the blindness can be irreversible. So.
Wow, that can be very scary. Very, very scary. So what can you tell us about the issues with the eyes? How common are they? I know we've heard about things like diabetic retinopathy. What is that? And how can people, the common man out there, how can they understand what that is and how to look out for it?
Yeah. So you have problems with diabetes problems with the eyes, that diabetes can cause. Diabetic retinopathy is one of them. The other problems, sometimes people go blind from just the optic nerve, the eye nerve just going off, just like that, from diabetes or any other nerve at all. So diabetic retinopathy is the commonest, cause of blindness, but you could also have blindness from issues affecting any nerve, including the eye nerve. So diabetic retinopathy actually is where the sugar, usually is common in patients who have had elevated sugar levels for quite a while. Like Dr. Afoke said, some people have, and they don't even know that they have diabetes. And then we pick them up in the clinics. They show up in the clinics and we look at the eyes and we're like, something is wrong with your blood sugar. You need to check. And that's where they get diagnosed at first. So if they've been we call it hypoglycemic. They've been hyperglycemic. They've been having high sugar levels for quite some years without even knowing. That causes damage to the eyes, the retina of the eyes. The retina is the area that we used to see, is like the screen, of the screen of the camera. The eye is like a camera, and the screen of the camera, that's where the retina is. The retina is filled with blood vessels, and we know diabetes damages blood vessels everywhere in the body, both the kidneys, all organs, the kidneys, the eyes. Unfortunately, the eye is just a sheath of nerves and blood vessels. And the eyes serve a particular sense, which is vision. So that's why all of them present with that initially, and then you realize that they have diabetes. So they could present with fluctuating vision, depending on the severity. Diabetic retinopathy comes in stages. So it depends on the kind of stage that they present with. I think I'll
Okay,
stop
thank you.
there.
I'm talking about signs and symptoms of that, but just quickly, if you can tell us a bit about diabetic, I think cataracts and glaucoma, are those common in diabetics as well?
Yes, cataracts. Well, we see cataracts in the aged, but people who are young, especially type 1 diabetes, they tend to develop cataracts earlier. So you see a young person with cataracts. Most times we want to screen for diabetes. Glaucoma, the kind of glaucoma diabetes causes is the bad glaucoma. So in diabetic retinopathy, where you have damaged vessels, and you have the early stages where the damaged vessels, the patients are asymptomatic, and then the later stages where the eye itself is trying to produce blood, to feed oxygen to the retina, and that causes um, blood vision and different symptoms, and so that really is the situation, with diabetic retinopathy and glaucoma. So where glaucoma comes in, the vessels produce bad blood, and these bloods now try to produce blood vessels that block certain areas where fluid drains out of the eye, and that's where glaucoma comes in. And that type of glaucoma is very difficult to treat. In fact, most times it's like glaucoma that has fallen off the cliff.
Yeah.
So most times they tend to lose the eyes.
Oh, that's terrible. Now, we've spoken about so many things, and we need to obviously talk about prevention. But before that, what are some of the simple symptoms that a person could have that they should go for an eye check on, or when they sense this or feel this, whether they have diabetes or they don't have diabetes, because obviously they might not even know they have diabetes, but they need to say, you know what, I need to have my eyes checked.
So blood vision, that's the first and foremost. They may have blurred vision, they may have floated. You see things, you think they're like mosquitoes, but they're actually in your field of vision. Then color changes, colors are not as sharp as they usually are. And then blindness, one eye, all of a sudden they see that one eye is not seeing clearly or not at all, and the other eye is seeing. Usually those are the symptoms that should prompt patients to access care, eye care.
Thank you. Thank you very much. Some of those kinds of misconceptions.
Yeah, so I think education, that's public enlightenment, programs like these would enlighten the populace about knowledge, about these possibilities. Sometimes we see these patients in the clinic And you tell them this is a problem, and they tell you, God forbid. They tell you that they do not have the problem. You're trying to educate them that this is a problem that they have, and they say, God forbid, I am not blind in that eye. So I think education plays a health education plays a great role, and health education can be carried out in different places, and that's where advocacy comes in, the public, the governments, the policies, um, the people who are in government generally, even the local people, the chieftains, they should all get involved in advocacy to promote access to healthcare, access to eye care. So because if they do not access the what is available, then how would they even know there's anything wrong with them? So that's where advocacy comes in, and then a lot of health educating the public. The public don't know a lot. There's so much they don't know, so much.
It's true. People die for lack of knowledge, and it's as true now as it was then. It's one of the reasons why this program was actually set up. But focusing on preventive care, how often should an adult, because screening for the eyes is not common in adulthood. We say they shave, you should do it when the children are growing up. How often should an average adult, this is not even a diabetic adult now, go for an eye check?
Well, a lot of people, some people are particular about their health, and they go for health checks generally, but they tend to miss the eyes. So ideally, I mean, it's advocated that after the age of 40, at least you should have an eye check once. The children, there are specific times that the children should get their eyes checked, preschool, you're changing school, at birth. Those times are opportunities. But, as an adult, we are struggling with daily things, So it's a bit difficult to tell a 27-something-year-old. Well, before they get into university, they get their eyes checked anyway. Maybe after school, when they're about to get into jobs. I think the jobs also help as well, too, when there are job placements. Medicals help too in checking eyes. But let's say that may cater for those up to the age of 40 years. So, but from the age of 40 years, every adult should get their eyes checked at least once a year.
Well, that's a lot.
Once a year.
But okay, so now if I can go back to you, Dr. Isiavwe, and talk about diabetes. A question was asked earlier, is there any gender or age specificity when we talk about diabetes, and when we talk about perhaps also Dr. Mildred, when we talk about diabetic eye disease? Do we find women more commonly affected than men?
Well, this is particularly type 2 diabetes, the incidence increases as you get older, that age 40. And then if one has a family history or one is overweight, such people would have a higher chances. Now, with diabetes and eye disease, if there's a family history of glaucoma or any of those conditions, again, the chances are increased. But I'll leave Dr. Mildred to tell us if there's any gender bias.
No, there really, diabetic retinopathy. Not really. There really is no gender bias. Age bias, yes, maybe. Like you said, above the age of 40, especially for type 2 diabetes. Strangely enough, we know we have type 1 and type 2. Anyway, the type 1s tend to be much younger. And they are the ones that are more predisposed to having diabetic retinopathy. Type 2 have, but the incidence is not as much as in type 1. But in terms of gender specificity, not really. It's all skewed, but we know that maybe there are more men in the job market, so they are the ones that get their eyes checked anyway before they get into jobs. So they are the ones that you see more in the clinics, than the women.
Okay. So I think that's another thing is we need to allow women to have themselves checked out more frequently. And we need to have special things, particularly in the markets and in more informal settings where women turn to work. So, Dr. Isiavwe, can you
Yeah.
tell us about well-being? Because we've talked about now eye checks and how important it is to have eye checks. How important is it to have general checks in general as a human being, particularly for diabetes?
Well, wellness, well-being, very important. We know well-being has several components, from mental health um, uh, to general physical well-being, emotional well-being, and all that. So it's important all those things are assessed for persons living with diabetes. I know a number of people would have mental health challenges coping with the condition, especially those who have to take injections every day, the ones with type 1. In addition, we've talked about the eyes, something like dental care, kidney checkup, and all those things come into play when one is living with diabetes. And we would usually say that for type 2, because type 2 tends to have been in the body for a while before it is diagnosed, so they would tend to have more complications. So when somebody comes to you with the diagnosis of type 2 diabetes, then it's a good time to just do a general check to make sure all is well. So in terms of well-being, we also talk about finance.
Yeah.
Finance, which is very important in managing a chronic condition like
Particularly at
diabetes.
this
Yeah.
time.
So financial aspect of it is critical, because you can see they have to see several specialists, they have to see the eye doctor, they have to see the dentist, they have to come for their A1Cs and all that. So finance is important, and it's a good time to mention health insurance here to help improve access to diabetes care.
Very important. So we're advising people in general to go for health insurance. There's now health insurance is mandatory. So it's important that people get aware of this and look for the best scheme for themselves. So talking about finance, the cost of drugs has skyrocketed beyond belief this year. We hear a number of people have actually completely stopped taking their medications. What effect are you seeing? How are you seeing this in your clinics, and what kind of advice do you have for people going through this?
It's the sad reality we're facing. So you have people having to make a choice between buying chronic medications or buying food or paying school fees or house rent. It's a big challenge. Uh, People who have health insurance tend to cope better. People who have jobs have health insurance because they don't have to pay the payment is taken up front and then they access care. However, people who are paying out of pocket and are struggling financially, they feel the bite the most. And it's those type of people that you see them begging for money for medications and all that. So again, I would recommend health insurance to reduce the bite and to help improve access to care.
If I can just jump back to the eyes and in diabetes, how do we treat? Are they prevent with them?
Yeah, well, management of these patients usually in conjunction with endocrinologists. We have to co-manage. So I tell patients, it's like a tap that is running, and all I'm here to do is to mop up the water on the floor. But we have to shut that tap, otherwise you keep mopping up and the tap keeps running and messing everything up. So it's multidisciplinary, multifactorial. Lifestyle changes, apart from the medications that they are on, lifestyle changes. They have to, because we know diabetic retinopathy is not just about high blood sugars, but those who are pregnant, pregnancy can accelerate development of diabetic retinopathy. Those who have kidney problems, those who have hypertension, high blood pressure, those who have fat, blood fat. Everybody knows cholesterol anyway. Blood blood lipids, yeah. So all those are all factors that can accelerate the development of diabetic retinopathy. So lifestyle change, lifestyle modification, weight loss, blood sugar control, blood pressure monitoring, kidney monitoring, stop smoking, reduce alcohol intake, or totally stop it would help with management. And then specifics, there are types of diabetic retinopathy they just need these lifestyle changes as well as good sugar control. Then there are the ones that will need injections into the eyes. There are the ones that will need lasers. And then the really bad ones will need vitrectomy, where they have to have surgery to correct, what is. And it's not that the surgery is totally infallible. The surgery just helps them get a bit of navigational vision. Because by the time you get to surgery, it's really bad. There's quite some damage within the vessels in the eye.
Mm.
That's it.
Wow. Thank you. That's important. So for those who are listening to the program, we don't have much time left. I'd like to ask Dr. Isiavwe. I'm aware you're doing some free screening in your clinic. Perhaps you could talk a bit more about it since the World Diabetic Day is tomorrow.
Thank you, Dr. Pamela. So 14th of November is the World Diabetes Day. We'll be having free diabetes screening at Rainbow Specialist Medical Center in Lekki Phase 1 on the 14th of November. Yeah.
So for those who are listening who just want to find out, please stop by and have it done. Dr. Mildred, do you have any other last words for our listeners?
Yeah, if you've been diagnosed diabetic, I mean, even if, because I know some doctors may not necessarily think about the eye when managing their patients, you should sensitize, your doctor to refer you to get your eyes checked. And for those who Dr. Isiavwe sees, that have newly diagnosed diabetes, she can send them to me at the Eye Foundation Hospital for free eye screening.
Fantastic. Thank you so much, both
Yeah.
of you, for coming on the program.
Thank you for watching. Please like, share, and subscribe for new video updates.